Bonjour à tous. La première chose que je dois dire, excusez-moi.
I'm sorry because I'm gonna have to speak in English because my French is not good enough. And well, the French is the most beautiful language in the world. My French teacher will be very sad, but they told me that I only have 15 minutes and I cannot speak French as quickly enough to cram everything that I would have to say in 15 minutes. Ever since I arrived here, when I talk to someone, I try to speak French, but then everybody answers in English. What a shame. What a shame.
So I'm going to switch to English. I'm a little bit more comfortable, even though my native language is Portuguese. I got to tell you at first that I'm really terrified to be here. I was told, I really thought it would be just like a speech for a classroom, and then I start to get worried when someone said, oh, you have to make up, and right there, and I said, whoa, what's that? So I wore my best suit, which is my only one that I have, because in Brazil, luckily, it's so hot that we don't have to wear suit. And here I am with my Japanese shyness in my blood, trying to tell you a little bit more about what we do in Brazil. One thing. Right after I arrived here, someone told me that there are 2 secrets to have the best presentation possible. You have to have good night's sleep, and you cannot drink coffee under any circumstance. I had just 1 hour and a half sleep last night because of time zone, and because of that I took like 4 cups of coffee, so I hope things here don't get a mess. First of all, I gotta tell that I'm not this guy. As you can see, I'm younger and more handsome. And this is Roberto Kikawa, the founder of Cies project. I'm representing him. Unfortunately, he couldn't come because of very good news that I'm sharing with all of you at first hand. We just started a huge project with São Paulo municipality, and we're gonna treat more than 200,000 people for the next 5 months, which is more than 2,000 people a day. And because of that, you can imagine he's running with everything, and I'm doing my very best to represent him. So Cies stands for Center of Integration in Education and Health. As we started with a dream, with a wish actually. It was a sad beginning. Roberto Kikawa's dad was dying from cancer, and his last will was for him, Roberto, to be a good doctor, to be a doctor of a good heart and different from those ones who had treated him from that cancer. And with that in mind, Roberto at that time was a young student at medicine school. He started to worry about what could I do in order to improve healthcare in Brazil. So now he's a very renowned doctor in Brazil, very famous, one of the best gastro doctors. But at the same time, he always been working in the outskirts area with the poor population. And eventually in 2008, he launched Cies project. I don't know how many of you have been to Brazil, but I gotta tell you a little bit more about the public healthcare system, which is not good at all. We say that we have the best legislation. All Brazilians must have free access to public healthcare, but the quality is quite bad actually. And that means that 74% of the population depend on this public health system, which is very poor. And it's even harder if you leave São Paulo, Rio, Brasília, the biggest cities, and you go to the agricultural or the small cities around. In some cities, you can't even find a doctor to treat. You have to travel. And in the smaller cities, we also don't have hospitals because it's too expensive to keep it. And that means that the population must go to the big cities in order to have the treatment. We also live, unfortunately, in a very unequal country. Brazil is one of the worst countries in this aspect. And that means that we're talking about different Brazils. When we talk about São Paulo, where we're based, almost half of the population has access to private health care, which means they have access with high-quality health service. But if you see all around Brazil, you're gonna see that most of people just can't have this opportunity. I'm not defending private healthcare, not at all, because we are striving every day in order to have the best public service possible for the entire population, so that we won't need it. And we can see the number of inhabitants per doctor. São Paulo and New York is almost on pair. But sorry, if you compare to the Amazon communities, for example, you have 8,000 people for each doctor only. It's very hard. So this is Cies. Cies is a project part of another NGO whose name officially is Ebenezer. And our mission is to take specialized, high technology and quality preventive medical care to any community, whenever it is. Because we want to be a synonym of excellence in mobile medical care. This is what we do, mobile medical care. With Roberto first identifying something that is very important in Brazil. We have 3 levels of public health care. The basic one, which is the general practitioner, when you go and you have the appointment, the general consultation, and it's quite good. Usually you can find near where you live, you can have an appointment. But the problem is that this doctor prescribes an exam, for example, and these people just don't have access to anywhere, any unit, health unit, to have these exams performed. So they have to go to the hospitals, and that means that this hospital, which should take care of the high complexity, like surgeries, they are always overcrowded with the minor, the medium specialization, which is our focus in Brazil. That's why we work with that. And our methodology has 3 main pillars, which are treat, educate, and prevent. First of all, we treat people because we believe that if someone is suffering from pain, like I'm right now, this person just can't improve their life conditions anyhow. So we provide our core business, medical consultations, exams, and surgeries. After that, we also educate because we believe that prevention is the best way to have the best healthcare system in Brazil. And so we spread information, we have campaigns about early diagnosis. Many people in Brazil still die nowadays because they don't have preventive health. And we educate now not only the patients, but also the doctors and health professionals as well. Because there's also a huge gap between doctors and professional health in São Paulo, in Rio, for example, compared to the ones who are countryside. Usually they're not updated, they just don't know the best procedure. And so everywhere we go, we have to train these people so that they can provide the best service in health. So as I said, we focus on the medium specialties, which are like lab tests, mammography, odometry, and all these specializations, so that the population can have the access of the best exams possible. These are some of the advantages. First of all, when you have mobile unit, you have accessibility. Many people just don't have a good treatment because they don't have money to go to the hospital. And it doesn't mean that the person doesn't have money to travel from one city to take a boat in the Amazon and go to the capital. This happens a lot. But even inside the big cities, the poor population lives on the outskirts and they don't even have the money for the bus, the local bus, to go to the hospital. So we help with that, lowering transport expenses, absenteeism as well, because the person just doesn't have to travel to have this treatment. We developed, this is our main secret, a quicker flux of consultation, exams, and follow-up, keeping up the quality, but we have a whole way to treat people and have it with the best efficiency possible. So we use the best equipment as well. We have a very integrated team of professionals, and the most important, we're near the local community. We are not near, we are inside the favelas, the shanty towns. We are where they live. So we look at their eyes, we live their lives. We're just like part of a big family. We understand their needs. This is something that for us is quite important as well. And at the end of the day, there are smaller lines in the hospitals because of that. So we provide this accessibility to specialized quality healthcare, empowerment of people through prevention. This is very important for us. And we aim at the sustainability of public health system. We believe that if we improve the public health system, everything will get scale and many more people, many more Brazilians will reach this high-quality treatment. So we've been to over 20 cities in these five states in Brazil, and we work on two main concepts. The first one, we work with the public health system. So all our patients are treated for free because the federal government sends the budget to the municipality, and the municipality must treat the patients. So we provide service to the municipality in that way. And this is quite important for us. And also, there's something that our differential, that means that we work with clusters. Wherever we go, in a small city, in the forest, in a favela, we try to involve all the stakeholders. This is something that works for the efficiency. So we talk to the local government that send the best, their doctors, so that the doctors can be trained, other health professionals as well. The local government take care of all the bureaucratic things like waiting lists and screening of patients. This would take too long for us, so this is what the government do, and most of the times they pay. And companies, we look for the small, medium, and big companies around to have partnerships to lower our cost and have better financial sustainability as well. So providing lodging, food expenses, and whatever that can help. And the community, it's quite important. So we always look for social leaders in a favela. Sometimes we are in favelas that, in Portuguese, we say not pacified, which are taken by drug dealers, which are very violent. So sometimes it's impossible to work without dealing with the second parallel power. And we also work with trade unions or NGOs. They help us knowing the population, also help with volunteer, like in the reception, everything else, so that we have a better sustainability overall. So you might be wondering, these are the mobile medical centers that we have. There are three types, the truck, the van, and the container. The truck is definitely a hospital on wheels. It's the biggest health wagon in the world, and it's better for cities of over 100,000 inhabitants, and it takes up to 10 specialties. We can use it in a customized way so that depending on the needs of the community or the population, we change it. This is a fast video that we have, so that it's just an animation for you to understand a little bit. So that would be the truck and two advanced boxes inside the truck, and you have lab exams, ultrasonography, cardiology, mammography, audiometry, endoscopy, small surgeries, odontology, ophthalmology. We believe in a holistic treatment of health, so we don't believe just treating one thing would improve the person's life. The health box was developed especially for example, the Amazon River, where we don't have roads. We have to transport over catamarans or ferry boats. And we're also going to have next year at World Cup in Brazil, all around the cities that we'll be hosting, we're going to have this health box perform exams with the population. We developed also the second health box, a little bit bigger and flexible for exams from 3 to 5 specialties. And the health van, which is smaller, and it's really good, for example, in Rio's favelas. It's very steep and it's impossible to go up with a truck. So it's very important for us to have this mobility as well, to be near the population. We work with an NGO as social business as well. So the NGO Cies is responsible for the treatment, the partnerships with the government. And at the same time, we have Flexi Medical, which is a social business that designs and builds all the technology, all the mobile medical centers. It's important to say that all the profit goes back to Cies so that we can improve and scale our activities. I'm going to pass very fast by it. If anyone has any question afterwards, I'll be walking around, be very happy, but I only have a few minutes more. So we work with tax benefits for donations, but at the same time, Flex Medical as a social enterprise can have social venture capital, for example, investment funds, and we're dealing with it right now. And the most important is that we have this trade, CS, rents the equipment from Flex Medical that personal, that customizes everything, and at the same time, all the profit from Flex Medical goes back to Cies, as I said before. So this is the core of what we do. We are very specialist in mobile medical centers. You might say, wow, Cassio, there are lots of mobile medical centers around the world, and that's true. You have, for example, Novartis mobile center, even HP, the technology, I've just known that they also have a mobile unit. But what we do is just, it's very integrated, everything that we do, and it's very customized, so that we have very specifically kind of mobile medical centers, and this is the largest in the world. And we have this adaptability, which is very important, the flexibility to use the 3 types of mobile medical centers in the best way according to the needs of the population. So nowadays, for example, and that's why Roberto is not here, we are building 5 hospitals all over São Paulo, which means that we will have a truck and many boxes all around in a van. And this mobile hospital will circulate inside each region around the peripheral area of São Paulo. This is the promise that he made to his dad, and something that we must every time work on, humanization, what we say the DNA of love. No matter if we are very efficient, we have many people being treated, we gotta look in their eyes, we gotta talk to them, we gotta have the best treatment possible. This is the core of why we are doing it. And we only can do it because we have a very competent team, health professional team, very trained. We don't have volunteers in the health team. We believe that we need a deep commitment in order to have this self-sustainability. And last, we have replicability. We've been to 5 states so far, and we are planning to go to some other countries. Next year, as I said, we're going to be all around with the World Cup as well. Oh, these numbers are not that updated. As I told you, we are so happy because we've been treating more than 100,000 patients so far in 4 years. But now, until February, we're going to treat 300,000 patients. So it shows how great we are approaching our mission. And it's going to be more than 2,000 procedures a day. And every year, our efficiency goes better and better, so that the costs per exam drops as well. I forgot to say we have partnerships with some companies which are really good. Sometimes they just not worrying about the population, but the importance is that we establish a win-win-win partnership. For example, Philips and Olympus, they provide high-tech, the best modern equipment possible, and this really nice and modern equipment can help us to have the best efficiency possible. Why they do that? Because some of this equipment, we can't even find the best hospitals in Brazil. It's important because, of course, their image as a social corporate responsibility, but also because if you think all our mobile units are like a showroom, so that wherever we go around, people, doctors are trained. Some municipalities might be interested in buying it. We don't sell anything. We don't do any effort on that. This is just something that happens organically. It's not. So it's a win-win partnership. And this last win, which is the entire population, it's the most important for us. Because of that, we've won a few awards, like Schwab Foundation for Social Entrepreneurship, Ashoka's. We are partners of Ashoka as well. We just seen a video. We're starting this partnership with Beringen and Ashoka this year. Well, you might say, wow, that's really great. So you have everything done. No, we don't. Most of you probably know social entrepreneurs, and social entrepreneurs are really crazy people who want to do everything at once. So there's still lots of things to get done. That's why I'm here. I hope we can talk afterwards and discuss how to get better that way. So we want to go north to the northeast of Brazil. One of Kikawa's dreams is to go to sub-Saharan Africa in order to have treatment. We already led studies there in many countries in Africa and saw that it would be perfect to have the mobile units right there. And next year we're going to start an operation probably in Peru, all over Peru as well. And for that, we need to attract investors interested in social return. Well, my time is over. I'd like to thank you. Je voudrais remercier
Thank you very much for listening. Thank you for your patience. You don't have my contact details here on the screen, but if you want to talk to me, I'll be here. I'll be standing here, and I will be very happy to discuss that with you. Thank you very much.